named Olive Vernosi loves beer. She's been staying at home as instructed. She's out of beer. She sent a photo to a local TV station of herself holding a Coors Light along with a sign that said, "I need more beer." That went crazy on social media, was shared more than 5 million times, and the Molson Coors company sent her 10 cases of beer, and she cracked one open as soon as it arrived. Wins News Time, 10:25.
Want to help your city? There is one thing we can all do to take action to help our families and communities. Take the 2020 census. It's simple. When more of us fill out the census, we get more money for the programs and services we rely on every day. It only takes 5 minutes. If you do it now, you'll avoid a knock at your door. And by law, your responses can't be shared with anyone. Go to my2020census.gov or call 1-844-330-2020 and complete the census now.
When you need to know first.
Is there any particular hospital in the briefing today?
He remains convinced that he has the authority, not the president, to reopen the state's economy. But Governor Cuomo says we need to turn our focus back on lives lost.
These were not 10,000 Democrats or 10,000 Republicans. These were 10,000 people. Forget the darn politics. Everyone's tired with it.
What the states need, says Cuomo, is federal funds to restart the economy. And he argues restrictions need to be lifted very slowly.
We have a real challenge ahead. Just because those numbers are flattening, it's no time to relax. We're not out of the woods.
Well, that's underscored by the daily death toll, which jumped to 778 and continues to ravage the nursing home population.
It just takes one staff member who didn't have a temperature, but did have the virus to walk in, and now you're going to have a serious problem.
The bit of good news from the governor, data continues to show the worst may be over. Al Jones, 1010 Wins News.
President their lives from coronavirus, according to researchers at Johns Hopkins. According to the Washington Post, there is a draft of a back-to-work strategy for the country created by a team led by the CDC and by FEMA. New York City health officials have revised up significantly to more than 10,000. They are now including people who did not test positive but are presumed to have died from COVID-19. Mayor de Blasio says the key now is to expand testing. He says the city is taking steps to do just that.
Starting in a few weeks, we will be producing here in New York City 50,000 test kits per week with components put together right here with companies, universities, New York City workers right here, building a brand new supply chain to feed this industry that will now develop in New York City.
The mayor said he hopes this will happen across the country.
Hopefully the example New York City is setting will be recognized in Washington, that if we can do it here, the place that doesn't produce tests has figured out a way to do it, then why can't it be done all over this country? Why can't we build up a supply that could protect all of us? If the federal government can't figure it out, then get out of the way and let us at the local level get this done. But support us. Get us the components. Get us the help so that we can do this rapidly and protect ourselves.
Wins News Time. Or just tell your iPhone or home device to play 1010 Wins and let's stay connected.
The News Watch never stops. This is 1010 Wins. You give us 22 minutes, we'll give you the word.
Good evening, 51 degrees, cloudy at 10:20. I'm Paul James. Here's what's happening. According to the Washington Post, there is a draft of a back-to-work strategy for the country created by a team led by CDC officials and FEMA. COVID-19 has claimed more than 25,000 lives across the U.S. Those who have recovered from the virus may be able to help others. Our Juliet Papa will have more on that. Today was the deadliest day so far in New Jersey. Accuweather calling for a mostly cloudy night with some rain and drizzle at times, overnight low of 40 degrees. Their states when they feel the time is right, adding he will not pressure any governor.
We'll be able to do that very shortly. We'll be announcing a date, but it'll be very short, and frankly, it'll be at a time that will be earlier than the deadline that we imposed, the end of April. So we think that some of the governors will be in really good shape to open up even sooner than that. We'll speak to them, but we're all set. We're counting on the governors to do a great job.
Mr. Trump also announced the administration is halting funding to the World Health Organization until a review is completed.
The silence of the WHO on the disappearance of scientific researchers and doctors, and on new restrictions on the sharing of research into the origins of COVID-19 in the country of origin is deeply concerning, especially when we put up by far the largest amount of money.
Many of those who survived coronavirus may now be in a position to help somebody else.
If you've recovered from the coronavirus, you can pay it forward. A plasma donation could help someone else battling the disease, according to Dr. Bruce Sakis of the New York Blood Center.
Patients who've had COVID-19 and are symptom-free for at least 2 weeks are able to donate.
Those antibodies are contained in the plasma removed from you in an hour-long procedure. It's stored until needed by a local hospital.
And that hospital would then put a needle into the patient's arm or through an IV and administer it right into their vein like they would any other transfusion.
This is an FDA-approved trial. The doctor explaining that plasma donation has been successful with MERS.
The Health and Human Services Inspector General describing a dire situation for frontline doctors and medical staff. HHS surveyed more than 300 hospitals across the country and found shortages nationwide. Nurses at Harlem Hospital are the latest to speak out about the desperate need for more protective gear.
There has been an influx of nurses to treat COVID patients at the city's public hospitals, but
most of our regular staff are getting sick and having to stay home. So even though there is more staff, we're still short.
Sarah Dowd is a nurse at Harlem Hospital and says respiratory therapists aren't getting the backup they need to help patients battle this respiratory illness. So many of them are out sick. She says the nurses want a compromise on mask use. In normal times, they use multiple N95 masks a day. They like one per day instead of one every 5 shifts. She says they're worried the strain they're seeing now is a preview of things to come from anticipated Medicaid cuts.
We are in the middle of a public health crisis. And any cut to public health funding is short-sighted and offensive.
She says it'll hurt the frontline staff and patients. Sonia Rincon, 1010 WINS News.
WINS News Time 2:09.
You're a small business owner, and there's
Working, and Governor Cuomo says New York, don't stop now.
599 people died from coronavirus since Sunday, and while saying this is not good news, Governor Cuomo does say it has been flat for 2 days and may suggest a flattening of the curve. But the governor vows not to relax like Hong Kong and South Korea.
They let their foot off the gas too quickly. And we have been behind on this virus from day one. Now is not the time to slack off on what we're doing.
The governor says the city hospitals and staff are running at peak, redlining, and he's asking the president to change the USNS Comfort's duty to handle coronavirus patients. He also urged local authorities to fine violators of social distancing, even if it's a funeral.
I don't care if you're Orthodox, Jewish, Catholic, Christian, Muslim, I don't care what. It's not about religious observation.
The governor says he has not heard anything about burying people in New York City parks, calling it a wild rumor. Al Jones, 1010 WINS News.
With dead in New York, most of them in the city, the mayor says there could be temporary burials.
If we need to do temporary burials to be able to tide us over to pass the crisis and then work with each family on their appropriate arrangements, we have the ability to do that.
Money Watch on 1010 WINS. Here's Joan Doniger.
Big moves on Wall Street because of smaller moves in coronavirus numbers. The Dow is up 1,258 points. The Nasdaq 431, the S&P 145. Governor Cuomo says the state's virus-related death rate has been flat now for 2 days. That was enough for Wall Street to send the stock averages up close to 6%. One money manager agrees you can't say we've turned the corner, but he does call it a good sign. If you can't find eggs at the grocery store, they will probably be likely to cost more when you do. Dow Jones reports wholesale egg prices have more than tripled as we've been stockpiling, and that comes as wholesale prices for other dairy items, including butter and cheese, have fallen. A lot of that is because restaurant demand is down, and that's complicating grocery ordering as we switch from eating out to eating at home. Egg supplies, though, are likely to be tight for a few months. An anti-disease effort that seems to be working, a program from Google's parent Alphabet to wipe out disease-causing mosquitoes, has succeeded in nearly doing so at 3 California test sites. Bloomberg Money Watch at 26 and 56 past every hour. I'm Joan Doniger for 1010 Wins.
While many others are able to stay at home, MJHS Health System and our selfless clinic.
Signs that the coronavirus outbreak is either leveling off or easing inspired a strong rally on Wall Street. The Dow Jones Industrial Average climbed 559. The S&P 500 added 84. The Nasdaq Composite jumped 323. The International Monetary Fund says the Great Lockdown Recession will be the worst in nearly a century, and it warns things will be worse if the virus lingers or returns. The IMF sees the global economy shrinking 3% this year. With its gyms closed amid the coronavirus outbreak, Town Sports reportedly is considering bankruptcy. The company owns the New York, Boston, Philadelphia, and Washington sports clubs chains with 600,000 members. The owner of the Ruth's Chris Steakhouse chain has received a $20 million government loan to keep people on its payroll. Wall Street Journal reports the chain got the loan 4 days after the aid was made available. Bloomberg Money Watch at 26 and 56 past every hour. I'm Larry Kofsky for 1010 Wins.
Wins News Time 2:15. It's been 10 days since British Prime Minister Boris Johnson was diagnosed with coronavirus. Yesterday, he was admitted to a hospital for tests.
We don't know what those tests are. We do know that Downing Street says that the Prime Minister continues to lead the country's effort to fight coronavirus. However, this morning, the Prime Minister's routine morning meeting with cabinet members was not chaired by the Prime Minister as it usually would be, but chaired by Dominic Raab, the Foreign Secretary, the first Secretary of State, the person who would most naturally step up to take over where the Prime Minister isn't available.
Correspondent Nick Robertson reports that Johnson is said to be in good spirits despite a persistent cough and fever. Johnson is 55. The acting Secretary of the Navy called the now fired commander of an aircraft carrier stupid during an address to the crew this morning. CNN says acting Secretary Thomas Modly called Captain Brett Crozier either too naive or too stupid to be in command of the USS Roosevelt. And he says Crozier intentionally leaked a memo to the media in which he begged the Navy for help as coronavirus spread among sailors on board. As of this morning, 173 members of the Roosevelt crew have tested positive for the virus. About 2,000 have been evacuated from the carrier. The governor of Wisconsin is delaying his state's presidential primary.
Wins News Time 10:33.
I'm attorney Matt Morgan with an important message. In times like these, the work we do at Morgan & Morgan becomes even more important. We will get through this together, and we are here for you, for the people.
Northwell is here to help New Yorkers get through anything, and the coronavirus is no exception. We've got a team of experts ready with a rapid response plan, so we're prepared for whatever comes. We've got specially trained staff members across 23 hospitals and 800 medical facilities who can safely identify and treat patients. And most importantly, we've got you. Let's tackle this challenge together. Learn more at northwell.edu/prepared. Northwell Health.
Wins News Time 10:33. Nassau County Executive Laura Curran says there is light at the end of the tunnel, and the light is getting brighter. She said the process of getting back to normal is going to take time.
It took 3 weeks since we declared that state of emergency, 3 weeks to get up to that plateau where we are now. And that climb down, it's not going to be an easy coast of a slide. It's going to be arduous. It's going to be painstaking. We have to work with our regional partners, but we have to think about how we come back, what that looks like, getting people back to work.
Curran says firefighters in the county have been hit hard.
Our records show that 199 of these men and women in our fire service have tested positive for COVID-19. 10 are cleared and back in action. Unfortunately, we've lost 6. 6 have died.
Rockland County Executive Ed Day has renewed his call for a temporary hospital to be set up in Rockland. He says the hospitals will soon be overflowing there, and he's asking Governor Cuomo to make this happen.
Rockland was originally included in the governor's plans for temporary hospitals, and we are asking that he revisit the plan as quickly as possible. We are nearing a point where local capacity could soon be overwhelmed. We need definitive action.
The county and several towns in Rockland have closed recreational facilities, and Day is now calling on Cuomo to close all state parks located in Rockland County. According to the Journal News, Day told the governor that keeping state parks open, quote, flies in the face of reason and is creating situations that put us at risk of spreading COVID-19.
On testing, a reminder that both the Bergen Community College and PNC Bank Arts Center drive-through sites, which we are running in partnership with FEMA, are operating still on a staggered basis. Tomorrow, April 7, only the Bergen Community College site will be open, and the PNC Bank Arts Center site will be open then on Wednesday, April 8th. Each site opens at 8 a.m. and it operates until it reaches its capacity of 500 tests. You must be both a New Jersey resident and you must be exhibiting symptoms of respiratory illness to be tested. Across the state, there are 15 other publicly run and accessible testing sites. These can be found by going on covid19.nj.gov/testing. However, there are many more sites being run by hospitals or other private sector partners that are not listed. If you believe you are showing coronavirus symptoms, please call your primary care practitioner right away, and they can assess you. And if you meet the standard for testing, they can direct you where to go to get a test. Last count, according to Brady O'Connor, we had 47 testing sites around the state. And again, we have a symptom self-assessment at covid19.nj.gov, along with a wealth of other information and resources. I want to thank the men and women of the IBEW, Ian Leonard, give Ian a shout out as their state political director, who made a donation of much needed PPE, N95 masks and Tyvek gloves, jackets and booties. So to IBEW, we say thank you. A couple of other updates. Spent a fair amount of time both last night and this morning with colleagues fishing with our fishing lines out for PPE in places as far flung as the PRC, the Philippines, Taiwan, and Israel. Had a very productive session this morning with Bob Garrett and his senior medical team at Hackensack Meridian, both to thank them for their efforts and for them to update me what they're seeing on the front lines, including things like converting cafeterias into hospital wards and a lot of other really good work. As I mentioned, Senator Booker and I, along with Judy and Pat, were just off of a very productive VTC with the Vice President. He and I were on the phone both Saturday and Sunday. We've already said this publicly. We got another 500 ventilators yesterday. 250, Pat, are with us, and another 250 are arriving later today, I believe. We also heard, which is terrific news today, that FEMA will extend its partnership with the state for the 2 testing sites at Bergen Community College and PNC Bank Arts Center until the end of May 31. So that was a huge lift of burden off of. And Ed in particular will be here to answer any questions you may have on the epidemiological front.
Did I bump Ed out?
You did, but Ed was very gracious about it. As we have been doing of late and will continue to do, let's get to the numbers up front, and they, as usual, of late have been sobering. Since yesterday, we have received another 3,663 positive test results. That brings the statewide total to 41,090. Again, 3,663, as you can see, new positive test results, bringing the statewide total of 41,090. And sadly, we must also report another 86 deaths due to COVID-19 complications. And with these, our statewide total has now eclipsed 1,000. It sits now at 1003. Again, each one of these blessed souls, blessed lives, we pray and mourn with their families and friends, and God rest them all. As you know, since the end of the week, our flags around the state have been at half-mast in whatever symbolic, but I have to say as well, substantive and heartfelt tribute to these lives lost. I also want to celebrate for a minute 4 of the lives that we've lost. Literally, I just learned not many moments ago of the passing of a good friend, Jersey City Councilman Michael Youn. I had literally exchanged notes with Michael probably about not more than a week ago. Look at that guy with that bow tie. He was a respected leader, not just in Jersey City, but in Hudson County. A good man, a great professional, a terrific husband, father, grandfather. We stand with Jersey City and with Hudson County in mourning his loss. We send our deepest prayers and thoughts to his family, an outstanding public servant and a really, really good guy. Colette Lamoth Galette. She was most recently a senior program officer at the Nicholson Foundation, but she is remembered fondly by so many of her many years at the New Jersey Department of Health, Judy, as you know. Colette was raised in Newark, educated at Yale, and dedicated her life to eliminating health disparities and improving the health and well-being of vulnerable populations across New Jersey. She was a prominent voice in both population health and environmental justice policy. In fact, she was working with my wife, First Lady Tammy Murphy, in the search for solutions to our mortality, infant and maternal mortality crisis among African Americans. She will be sorely missed, and she was loved by so many. God bless you, Colette. Daisy Dora Nila. Look at Daisy, bless her. She served as a nurse at the Hudson County Correctional Center for more than 20 years, and we lost Daisy yesterday morning. She was a single mom. She lived in Nutley for many, many years. She was a proud member of District 1199J, AFSCME, and I was back and forth with Sue Cleary, its leader, yesterday, mourning Daisy's lost. I spoke yesterday with Daisy's daughter, Denise, and came away with a deep appreciation for how much she gave to her family and her community. Again, a heroic healthcare worker, single mom, a blessed soul, and a life lost. How about Susan Sakala? She was a registered nurse, there's Susan, for 37 years, working at both Clara Mass Medical Center and Northern State Prison. She was also a wife. Her husband, Stephen, works for the State Medical Examiner's Office, a mother, a grandmother, an aunt, and a sister. In fact, here she is holding her first grandchild, Justin. Her loss will be felt by so many, and our hearts and deepest sympathies and prayers again are with her family. They join the souls we have already memorialized, including yesterday on social media. Weehawken Finance Director and longtime Board of Education member Rich Barza, and Javiera Rodriguez. Javier was a member of the child study team at Beckton Regional High School. Every single one of them, named and unnamed, was a cherished member of our New Jersey family, and every one will be remembered and never forgotten. I know these numbers can be scary. Seeing the faces we have lost makes all the more real, I think, for each of us. But we cannot give in to fear or sadness, and we must resolve to continue our fight together to crack the back of this crisis and flatten the curve so we have fewer and fewer lives lost and friends to mourn. And we can do this. We are now 2 weeks into our most aggressive push for social distancing. I know it feels much longer, by the way, for all of us. Trust me, we all up here feel that too. But we have to do this. We have no choice. We have to take it seriously, and we have to bat 1,000. Pat will, before we turn to questions and answers, Pat will give us a quick overnight compliance update. When we began our first discussions for responding to this emergency as far back as January, well more, by the way, than a month before our first case of COVID-19 was ever confirmed. We knew that our best chance of getting out in front and staying in front would require a data-driven approach. As I've said many times before, and Beth embodies this, Judy and her team embody this, we are a Moneyball operation. We think if you get the highest quality data and you make your decisions based on the data, you make the right decisions ultimately. We would not leave anything to chance or rely on anecdotal evidence to the very best of our abilities. We knew that only an objective, fact-based, and as I said, Moneyball approach would get us through this. And it is through this approach that our aggressive stance on social distancing has taken shape. That's an important point to note here. We didn't just pick social distancing because it seemed like it might be a good idea to try. We did it based on the facts, based on historical and current facts. With great help from Beth and her team through the Office of Innovation, and I want to give a particular shout out to Lakshmi Subramanian, in partnership as well as in partnership with Judy and her team at the Department of Health, we have built a strong, modeling program that we can use with great and increasing confidence. So today, as I predicted over the past few days when we've been together, we'd like to share some of that data with you. And what we could see together is that while we are not anywhere close to being out of the woods as of yet, we are clearly on the right path to get there. So here goes. The first slide, for example, shows the progressive rise in the total number of positive test results. As I have said many times before, we fully expect these numbers to rise to the levels they are rising to, and we expect them to go higher. However, what we are seeing in real time and over the past week is a decline in the growth rate of new cases, from 24% day over day on March 30th to roughly 12% today. This means that our efforts to flatten the curve are starting, and I say starting, to pay off, even with the lag time in getting testing results back from the labs. There may still be anomalous days with spikes and troughs, and we've seen them already. But the overall curve that we fit into the data is beginning, and I say beginning, and I use that word again cautiously, beginning to flatten. Our job now is to keep flattening it to the point where our day over day increase is not just 12%, but is 0. That brings us to our second slide. The shadowed line shows us where we would be had we done nothing, had we allowed for business as usual. The second line below shows us our trajectory if everyone relaxed their social distancing and stopped staying at home. So you can see the big uptick there. That's projected infections. And for those of you who may not be able to see that, that is approximately, Beth, 3 million infections. Am I right? Yeah, I believe that's 3 million. And you could see the opportunity to be meaningfully under that if we keep doing the social distancing. The range remains wide, and it remains uncomfortably high at the high end. But it is, assuming we continue this social distancing, and that's the key, by the way, it remains meaningfully, even at the high end, below the numbers at which we had done, or for which we had done nothing. Again, if we continue to practice our social distancing, if we continue to practice smart hygiene, if we continue staying home unless we absolutely need to go out or are needed to get to an essential job, we could stick ourselves much more toward the curves on the bottom. And if we do, we get to the peak of that flatter curve much more quickly, which means we could drop down the other side of that curve much more quickly as well. Again, at a minimum, the peak between the lower curve and the upper curve is a 420,000, between those two bottom curves rather, plus positive cases that we can prevent. This should be all the incentive we need to keep doing exactly what we're doing, because this is not a game. It is in every sense, and we've seen it already too starkly, a matter of life and death. So this is projected infections. Let's go to the next slide. We don't have a lot of them. This is projected hospitalizations. And as Judy said, this is the one that she lives with. This is again projected hospitalizations under a couple of different scenarios. If we keep our current practices, we could get through the peak with the hospital beds that we are preparing. The new wings, the reinstated buildings, the field medical stations. It will be tough and it will be stressful, but our health system can get through this intact. However, if we relax our social distancing and we put ourselves on the higher curve, we will overwhelm the system to the point that all of our contingency plans and then some will need to go into effect. Our healthcare system will be overrun with a surge 4 times what it could be. That is a nightmare scenario on a good day. But in a sustained pandemic such as this, it would be literally disastrous. We already are doing all that we can and turning over every stone to uncover every N95 mask, every set of gloves, every face shield, every piece of PPE, along with every ventilator we could possibly mobilize. We have a tough enough job as it is on the lower curve, by the way, but we believe fully that we can make it given our rate of PPE acquisition. However, if you all stop, if we stop with our social distancing and we go to that higher curve, then it is not only your life that it is in much more danger because of lack of supplies, but it will also mean that our medical personnel and our first responders will be in that much more danger as well. Our goal is to not just have the PPE and ventilators we need, although that is a huge goal, but to get them to where they will be most needed in the coming days and coming weeks. One more slide for you. This slide shows us that's the PPE needs I just went through, and I want to keep, if you could, this slide shows us, the next one, Mahan, shows us currently where those of you, which zip codes where currently those of you are visiting covid19.nj.gov and taking our self-assessment are reporting from. And as of this morning, this self-assessment has been used nearly 209,000 times. So this is not the easiest to read, but the counties, the zip codes are in counties Passaic, Middlesex, 2 in Middlesex, 2 in Hudson, a 3rd in Passaic, and 1 in Somerset. Those are the most often self-reports right now. From these self-reports, we can get an early snapshot of where COVID-19 symptoms are beginning to be exhibited and with greatest frequency. These are the potential hotspots that we are currently tracking, so we can begin to assess our future equipment and PPE distribution needs. Our goals from day one have been twofold. One is to flatten that curve and to give our healthcare system the ability to withstand the onslaught. And 2, ensure that the equipment and PPE our frontline responders need gets to where it's needed most efficiently and before there's a crisis. These modeling scenarios, which Beth and her team and Judy and hers are constantly updating, are how we meet these twin challenges. I say constantly updating, literally. These models tomorrow will look differently than they look today, and they look differently today than they did yesterday. It's how we save lives, and it's how we ensure that we'll come out of this sooner and that we come out of it, as we know we will, stronger together. We could all take some pride in the work that we've done so far. The curve is flattening, but this is no time to spike any footballs or to take our foot off the gas. Even if the curve is flatter, we still have a week and a half to go at least until we hit the peak. This is not over, and not by a long shot. Our charge to you remains the same. Keep social distancing. Keep washing your hands. Keep staying indoors. Keep being smart. Stay at home. Now, if I may switch gears before we hear from make a couple of announcements. First, today, signing an executive order to allow retired public employees to return to work in whichever capacity they can to help us throughout this emergency without impacting their pension status. Right now, we need all the experienced help we can get, whether it be retired law enforcement or officers returning to duty or nurses who can return to
Wins News Time 10:30. Good evening. I'm Paul James. Today, New Jersey had the highest number of COVID-19 deaths so far. Governor Murphy said his state cannot get back up and running until there is adequate testing available.
The governor says he understands the frustration of waiting on long lines to be tested, and he is frustrated too.
Boy, we need help, and we're not alone. Every American state needs help on testing, and that includes this one. I have been relentless in advocating for expanding testing with the White House, with our federal partners, and I won't stop until our testing regime is where it needs to be.
Murphy defends New Jersey's efforts, saying they've run the fourth most tests of any state in the nation, and the three states ahead of Jersey have larger populations.
I think we've played a very tough hand as well as it can be played.
And Governor Murphy insists that adequate testing is necessary for restarting the New Jersey economy.
We need reliable, safe, quick access to testing for everyone, and we need it everywhere.
Roger Stern, 1010 Wins News.
The governor of Iowa has decided to ditch outside models tracking COVID-19 in her state.
Tuesday, Iowa Governor Kim Reynolds announced another 189 coronavirus cases, the highest number of cases reported in her state in a single day. Long-term care facilities appear to be the hardest hit. However, there's also a hot spot in the same county as a Tyson meat processing plant. Iowa's Department of Public Health and University of Iowa College of Public Health began creating their own statewide models, which are being used by the government. The governor says outside models have been wildly off. Iowa has not declared a stay-at-home order.
Correspondent Ryan Burrow. Wins News Time 10:30.
Terms in the White House with Barack Obama.
Choosing Joe to be my vice president was one of the best decisions I ever made.
In a video, Obama called Joe Biden a close friend, the perfect candidate right now.
Joe has the character and the experience to guide us through one of our darkest times and heal us through a long recovery. And I know he'll surround himself with good people.
Obama rarely talks directly about his successor, President Trump. The endorsement gives Biden a big boost from the Democratic Party's biggest fundraiser. Barack Obama is expected to headline fundraisers for Biden and public events in key swing states if social distancing guidelines are lifted. Ed Donahue, Washington.
A New York City man, 30-year-old Kevin Fallon, has been arrested, accused of texting several friends that he was going to blow up the statue of Alice in Wonderland in Central Park with a pipe bomb. Cops say they found several empty pipe bombs in his apartment, along with ammunition and several knives taped together. According to court documents, one text said, "This is going to hurt. None of you are safe. I am lethal," unquote. Millions of students will graduate soon, but there will be no in-person commencement ceremonies at high schools and colleges. Many schools are expected to do something online. Wins News Time 10:17. Hank Steinbrenner died today.
Hank Steinbrenner, the oldest son of George Steinbrenner and one of four siblings who owned the controlling shares of the New York Yankees, died on Tuesday. He was 63. The team said he passed at home in Clearwater, Florida, due to a long-standing health issue. It was not believed to be related to the coronavirus. Hank was a chain smoker who had hoped to succeed his dad as Yankees' controlling owner, but his brother Hal, 11 years younger, was put in charge in 2008. Hank Steinbrenner is survived by his four children, a granddaughter, and his siblings. Mike Mancuso, New York.
WNSHD, WNAWHD3 New York.
A radio.com station. Winds News Time 1:59. Here's your 10:10 Winds Accuweather Forecast. Such a lovely day. Mostly sunny. It's mild. 66 the high. Could get up to 70 in parts of New Jersey. Mostly cloudy tonight, down to 50 degrees. Tomorrow, look for sun and clouds. Another nice 163. We do have some rain in the forecast tomorrow night, and then Wednesday, mostly cloudy, couple of showers still, 61. Thursday, cloudy and windy, still the rain, and a high of 58. It is 61, fair skies, the humidity 35%, winds are variable at 5, gusting to 20 miles per hour. More people get their news from 1010 Winds than from any other radio station in the nation. Sarah Miller's our service aide, Justin Traeger is the writer, Ronnie Stern is at the editor's desk. I'm Susan Richard.
All news, all the time. This is 1010 Winds. You give us 22 minutes, we'll give you the world.
Good afternoon. It's 61 degrees at 2 o'clock. I'm Larry Cantor, and here's what's happening. New York's coronavirus numbers appear to be leveling off, but Governor Cuomo says it's too soon to say for sure and certainly too soon to stop social distancing. Mayor de Blasio says temporary burials are a real possibility as coronavirus deaths mount. The federal government sends hundreds of thousands more N95 masks to the city. This year's school regents exams have been canceled. 1010 Winds, Accuweather, mostly sunny, a high today, 66.
This is Andrew O'Day of Bloomberg. U.S. stocks rallying on signs of coronavirus rates ebbing in some countries of the world, although not all of the U.S. yet. The Dow up 1,238.
Winds News Time 2:01. From the 1010 Winds Traffic Center, here's Elliot Goshman.
And here's what we see online.
North Shore Hospital tells 1010 Winds they need more medical staff.
We're asking for everybody to come and volunteer and to help us. We need more ICU doctors, and we're getting them from people from around the country are coming in, and for nurses too. I know that they are hiring nurses, traveling nurses, and also we're getting locum tenens doctors to come and help us staff the ICUs.
Gottesman says North Shore is okay as far as ventilators on hand, but he's concerned that if there's a big surge in patients, they will be in short supply. First City Playgrounds, now dog runs are closing. This is because not enough dog owners are social distancing. Well, pet owners have many questions after it was revealed that Nadia, a tiger at the Bronx Zoo, tested positive for the virus. Officials say 6 other tigers and lions have also fallen ill, but they're all doing well and they're expected to recover. The zoo says it appears Nadia was infected by an employee who was not yet showing symptoms. So, what does this mean for you and your house pets? Well, I spoke with veterinarian Dr. Ann Hohenhaus from Manhattan's Animal Medical Center. She says you should wash your hands before you touch your pet, and even if you're not confirmed sick or are not experiencing symptoms.
Right now, the recommendation is if you're well, you can still interact with your pet with good hand washing. However, if you're sick, definitely no kissing, no sharing of food, no mushing with the pet in bed because you're feeling sorry for yourself and you're sick. That pet is out of quarantine and with the healthy members of the family.
Hear my entire interview at 1010winds.com. Winds News Time 151. Now traffic and
could be buried in city parks on a temporary basis. A spokesman for the mayor says they are not currently planning on using parks, but maybe Hart Island. The mayor spoke with reporters this morning at the Brooklyn Navy Yard. He just visited a couple of garment manufacturers that have converted their operations to producing much-needed hospital gowns. The mayor says they should have 19,000 by the end of the week, and he says they are reusable. He also thanked the Trump administration for sending a new supply of N95 masks. He says there should be enough to get us through the week. De Blasio says the city is abandoning a pilot program that closed some city streets to vehicular traffic so people would have a place to walk or exercise without getting too close to one another. He says not enough people were using the streets, and they required too many police officers to enforce social distancing. He also says people must not gather for religious reasons, even a funeral.
We're going to be very clear with people. We just cannot tolerate at this moment in history any gatherings. And unfortunately, we have no choice, and the